Okay, let's get going. These people have been. Okay. All right, I think we're ready to go. We'll start the Shawnee County Board of Health. It's June 11th, 2020. And first off, we have a presentation by Dr. Pezzino.
Good morning, Commissioners. Gianfranco Pezzino, Shawnee County Health Officer. I'm here to present you an update on the numbers that describe our infections as of last week, as we have done for several weeks now. Wow, makes noise. As usual, this is the first chart that we always show. This is the number of confirmed positive cases, laboratory confirmed cases by week. The day indicates the first day of the week. As you can see, unfortunately, we reached another high last week with 71 cases reported. So definitely not the trend that we would like to see. You've seen this slide before. I'm not going to spend much time, but it's clearly not an equal distribution, equal opportunity pandemic in our county. And there are some zip code areas, especially in the eastern portion of the county, that are more affected than others. Confirmed cases by race, you can see that African Americans, even though they represent roughly, I believe, 7 or 8% of the population in the county, account for about 12% of the cases. But perhaps even more striking to me is these slides, where the blue portion represents the share of cases for Hispanic or Latino, and that's almost half of them. Clearly disproportionate amount of cases among Hispanics compared to their share of the general population, which I believe is roughly 12%. I'm not 100% sure. We talked about that before. That trend is actually worsening. More and more of the new cases that we are seeing are in this subgroup of our population. The question is often asked if that could be the result of increase in the number of tests. I have never believed that that was the case. That alone cannot explain our increase in number of cases. And last week, actually, is probably one of the best examples we have when the number of tests went slightly down and the number of cases went up. So I believe that we are seeing still transmission, and we are possibly seeing more transmission now in the county for the virus than in prior weeks. Another element that sort of supports the statement is the fact that we have a relatively high percentage of positivity out of all the tests that were performed. So it's close to 5%. So you can see it went up and down. Of course, our peak was when we first started testing back in March. At that point, we could only test the most very sick people because of the shortage of testing kits. And then we went down in April, and now we are up around, around the 5% mark. This is the slide where I would like to see those numbers as low as possible. These are people with no known source of infection. So it means that they just got it somewhere, but we don't know where. And that number is higher than, was higher last week and the prior week, 17%. It's not the highest we have seen, definitely, but it's high enough to cause some concern. Hospitalizations per week. So last week we had 9 hospitalizations. As of today, I believe we have 5. 2 days ago we had 8, so we have a fewer today or yesterday than a couple of days ago. And unfortunately, one of the reasons is that one of the people died. So we had our 8th death in the county. And I want to take a moment to express my condolences and sympathy to the family of the individual who lost their life just a couple of days ago. Nothing really new on the age distribution as expected. The age distribution for hospitalized patients, the majority is 55 and older, but again, we still have a sizable proportion in younger people. And I was told by our colleagues at the hospitals, I asked about the age distribution of the currently hospitalized cases, and there are some that are below 50, and there are several of, there are a few of those people who are acting on ventilators, and our colleagues were really concerned about their health status when I talked to them a couple of days ago. This is the scorecard that we're starting to use. As you remember, we we identify 8 areas of capacity that are really important for our public health department. And for each area, we have 3 levels: green, yellow, and red. Now, I will repeat the same sentence, bear with me, probably every time I'm going to show you this card, because I want no misunderstanding about this. This is not a performance scorecard. It's not to tell you how good the people at the health department are in doing their job. It's a capacity scorecard. It's telling you how much the health department is able to cope with the current workload. As you can see, we have a few yellow, we have mostly green, so it's definitely not, I mean, there is still some space for extra capacity. It's definitely not a point where we are close to collapse. I also want to tell you that colors and numbers don't say the whole story. There is a lot of effort behind this. I don't know when was the last time that our nurses who are working on COVID-19 response were able to take 2 full days off. I don't think that happened since March. Yes, Commissioner.
I can't read any in the red. What is in the red zone?
So the red, so this part on the right, those are just the criteria that we use. So the scorecard for the week is the part on the left.
Okay.
Okay, so we have nothing on the red for this week. So essentially we have a grade. For example, if you take testing, if we are not able to assure enough testing in the community, then the testing will become red. But it's not. Right now it's green. Same thing for locator interview cases. If not all the cases are interviewed, then we go into the red. But right now we are in the green. Okay, there's something else I wanted to tell you, and I thought I had a slide, but somehow it disappeared in cyberspace. Last week was a very busy week for testing for our health department. As you probably know, the health department started a testing program, I believe about 3 weeks ago, if I'm not mistaken. Originally, it was limited just to uninsured individuals. It takes place twice a week in the parking lot of Highland Park High School. Clearly, that's an area where we know from our zip code map where we have a lot of need. We have a higher concentration of cases. The first few weeks were a little slow. Last week and this week, the testing opportunity was open not just to uninsured, but anyone who has symptoms and wants to be tested. The positivity rate of the tests that were done the last couple of times was close to 25%. Commissioners, that's huge. Across the county, we have a 4%. The tests that are done at Stormont Vale roughly have about 4% positivity rate. We have 25%. What that tells me is that, number one, there is still a lot of circulation of the virus, at least in that part of the city and possibly elsewhere. And number two, there are still people who have difficulty accessing testing, and they're waiting for our staff to go and pitch the tent in the parking lot to get the test done. I also want to commend the staff at the health department, the effort that they have put up for the testing is incredible. It was a hot week last week. Not only did they do the testing for everybody with symptoms, they did an expanded testing program for a company in town where there were several cases reported. That was one of the days with 95 degrees. I've seen the picture. I can't imagine how they were able to do that and carry on through that experience without anybody having a heat stroke. And, yet they put their heads down and do what needs to be done. So I really want to commend the health department staff. I hope you feel appreciative of what they're doing. I respectfully invite you to show that appreciation, both during the meetings as where, stop by, say hello, bring some cookies, do something to make them feel better. I'll be honest, they are stressed out. And they can use all the help and support that they can get.
Mr. Chairman? Yes. Doctor, the 25% rate that we're seeing in Highland Park, we're at 9 deaths for the county total. We have 8 hospitalizations as of yesterday on the dashboard. With that high of a percentage, is it that we are just seeing people stay at home and trying to tough it out, for lack of a better word? Or what's going on that we have that high of a percentage, but in that concentrated of an area? What's going on?
Yeah. I think what's going on is primarily many of those cases are among younger individuals who are healthier than others in the community, so they have fewer underlying conditions. So as a result, many of them do not develop severe disease. I think that's really what we are seeing. Now, why we have so many there, I think it's really a problem of access, and it may be in part a little bit of a denial process where unless the testing comes close to their home, they don't feel enough motivation, or they are not afraid or concerned enough to go and get tested somewhere else in town where other testing facilities are available. I can tell you that, obviously we know that there's a lot of Hispanics who live in that part of town and in the northern part of our city. I can tell you that out of the patients that were hospitalized early this week, a good number of them fell into that category of, Hispanic, and many of them, not many, I mean, we didn't have a lot, but more than one patient was not in the high-risk age category. So I think, Commissioner, in brief, what we are seeing is that I believe there is more virus circulating, there is increasing transmission. Whether that is going to be reflected soon into hospitalization numbers or not, I really can't tell you. Maybe it won't if the people who are affected are primarily young and healthy.
I took a moment to look up, and the Hispanic population is at 12% for Shawnee County on the 2007 data.
And we have about half of the cases that fall into the category. So clearly they've been affected more than anyone else in the community.
When we're looking at that, is there again, I'm trying to understand why we have such a high percentage, but not the high rate of hospitalization in young and healthy and maybe not as affected, but is there also maybe a reluctance to seek medical care, and that they would rather stay within their community and have their caretaker or family member take care of them rather than open themselves up to outside influences?
Yes, those are all possibilities, Commissioner. I don't know the exact answer. I can tell you that we were just talking with our senior staff in the last 24 hours. I would like to try to engage some providers from that community who can, number one, tell us a little more what's going on, tell us more the story. I like to always say that these are just numbers, and then there are stories around the numbers. And the stories are a little harder to capture. So I would like to reach out to some of the providers in the serve that Hispanic community and try to understand from them, maybe give us some answer to the questions, and maybe for them to also help us reach out to that community. We already have an outreach person who is a Hispanic and lives in that community and is working with Dusty and the rest of the team, try to do communication and outreach in the community. But I think having also a provider on board that can help us find those answers and maybe avoid that people stay home unnecessarily and put their lives in danger.
From my experience, anecdotally, we have a vast majority of the Hispanic population, or not vast, but a large amount of the Hispanic population that may not want to draw attention to themselves due to a legal status and concerns about it that it may trigger other federal action or leading to deportation. So if we stay quiet and keep this within our community, and again, I'm just trying to understand
Yes.
why.
Yes. Commissioner, you're asking the same question that we are asking ourselves. And we have some hypotheses, but we really don't have final. As you know, we like to base our actions, our answers on data and evidence, and we really don't have enough evidence at this point to answer well. I think these are all plausible.
Mhm.
I can't tell you to what extent they contribute to the fact that we have so many positive when we test in that part of town.
Are we interacting with the faith community and the Hispanic faith community to see if we might be able to, again, get more information?
Yes, yes, we are. It's a big effort. Mayor Michelle de la Isla has been extremely instrumental in leading that effort, and we will continue that effort and try to reach out as much as we can. We really do not want people to stay home and be afraid if they have symptoms that could be indicative of coronavirus, because that's a very dangerous decision. That's a decision should be made with their provider. Some people can stay home. I'm not suggesting everybody needs to be hospitalized. But patients, sick people should not make that decision alone. They should discuss it with their provider.
All right, thank you.
Thank you.
Doctor, these new cases, are they related to any particular area of employment or anything like that? Do we see like in Dodge City, they had packing plants where they had over 600 cases a couple of weeks ago, which resulted in, well, they only had 5 hospitalizations from that, but 600 cases, and they related to that. Do we have a situation like that, or we?
I think employment plays a role in that. We did have a couple of clusters in the county in industries that primarily employ Hispanic people as workers. We have investigated those, and we don't have any large cluster as of now. But yeah, that's, speaking of the whys, I strongly believe that possibly the main reason, but certainly one of the reasons why we see so many cases among the Hispanic is because of the type of occupation that these people are involved in, which often require to work in more confined space, shoulder to shoulder, and to keep working for as long as they can, because sometimes they can't afford to take sick leave, although I know that many good companies in the county are granting sick leave if people stay home because of coronavirus situations. So I do believe that occupation does play a role.
Okay. And you said of the new test, it was like 25% were positive. Is this the?
It's a small sample. I want to put some qualifiers there, but
This was the testing we're doing over by Highland Park High School?
Yes.
Okay.
yes.
All right. What's the latest on herd immunity? Does that have an effect on this disease or this virus?
Not yet. We haven't reached nearly any level where herd community could even come into place. I don't know how many people have been infected in Shawnee County. The only way to know is to take a random sample of people in the county and then test their blood for antibodies. And I know that the Kansas Department of Health and Environment is planning a survey statewide to do exactly that. I don't know if that will be done at the level of sample size that would allow us to draw any conclusion just county by county or just for the entire state. But I can tell you, as you know, herd immunity usually kicks in at the level of immunity of 60 to 65%.
That's kind of what I've read.
When they did the first survey in New York City, and we all know how bad the situation was in New York City, they reached the conclusion they had about 20% of people having been infected in New York City. So I believe it's certainly in the single digit in Shawnee County, but I can't tell you where.
What about indications from other countries that were kind of hit before we were? I see where Italy's numbers are really going low now. I don't know about other countries over there. I just happened to read an article on that.
Right.
They seem like they're ahead of us about a month or so on this whole virus thing.
They are ahead of us in many different ways, not just in terms of time, but also in terms of what measures some of those countries decided to implement. You mentioned Italy, and as you know, I'm in contact with my family in Italy, and I follow that very closely. I try not to get emotional when I speak about that, but I have a lot of admiration for my home country right now. What they had to go through was incredible. It was 2 full months of absolutely strict lockdown, and I mean strict. You could not leave your home without having papers that would justify and explain why you were leaving, where you were going. And by the way, they would check those papers, and they would give you fines if you were in violation. The price that they paid is incredible. They are coming out of lockdown. They started just last week, and the number of cases is still going down. So not only have they not seen a rebound, they are still seeing the same trends. They are doing things very slowly. They are lifting those measures a little bit at a time. That's only Italy, of course, but if you want to take a bigger look, there were a couple of papers that were published just this past week on 2 different journals and 2 different research groups, and the conclusion was that they think that the lockdowns in the United States alone may have prevented about 50 million cases, and obviously certain number of deaths as well. So the more we learn, the same discussion we were having last week, the more we learn about this virus. At the beginning, this was a novel virus. We didn't know what would work, what didn't work. Commissioner, you asked last week, do we have to go back where we were 3 months ago? And my answer was, I don't think so, because we are starting to know what works better in which circumstances. And so now that we have the experience from all those countries, people are starting to put all the data together, and it's becoming clear that those lockdowns, as painful as they were, really helped in diminishing and decreasing the number of cases. Now, putting aside the economic costs, and nobody denies that, but from the pure perspective of containment of the disease and the infection, that was very effective.
What about the countries? Was it Sweden that didn't do the lockdown? Or?
Sweden is an interesting country. Sweden did not go into a full lockdown. They took several measures to social distance. They shut down their schools in part, not all of them. I think they kept their primary schools open and they shut down the high schools. I'm not 100% sure. They canceled mass gatherings and mass events. They have a very strong hospital system, and they were not overwhelmed. However, the number of cases that they had, and even worse, the number of deaths that they had, was the highest in the entire Scandinavian peninsula. So if you compare that of Sweden to that of Norway and Denmark and other countries in that area, they are not doing very well, to the point that actually just last week, the main epidemiologist who developed the plan for Sweden came public and saying, maybe we went a little bit too far. Maybe we should have been a little bit stricter. And same thing in England. England started a little late. They were trying to follow the same principle of herd immunity until they decided in the middle of that process to change course, and they went through lockdown. And the main researcher who developed the plan just came public, I believe yesterday, saying, I now believe we could have averted a lot of deaths if we had started this earlier.
Did they avert deaths, or they just have a bunch at once instead of stringing it out? I mean, that's, you see what I'm saying? When you
The comment I heard from him, we could have averted a lot of deaths.
Okay.
I'm just telling you, I didn't check that directly. That's a comment that was reported in the media.
And of course, Australia and New Zealand, they're going into winter now. Are they seeing another round of this where they're going into their flu season?
I think it's a little too soon to tell because it's very, very early in the season. New Zealand is another very interesting, intriguing example. It's an island, obviously, or a series of islands, and their main control system was to shut down the borders immediately. Now, again, they had the advantage that they were not the first that had to do that. They were looking very carefully what other countries were doing, and the time they had the first case, they shut down the borders really completely. It's also a country with a lot of social cohesion. Their leaders are trusted, and people follow what the leaders say. Their leaders are they don't hold it back. They tell people the way it is. Now it's time to stay home. Now it's time you can do these things, and people follow those recommendations. As a result, they're free of the virus right now. They haven't had a case for several days.
They have the benefit of being an island,
Definitely.
Probably so.
But it was still tough choices to make, and they made them, and they stuck to them.
We still have they're not recommendations, they're orders. Do you still feel like they're necessary, all the orders we have, or could we move to recommendations like a lot of counties have done, or?
If I didn't think the orders were not necessary, I wouldn't keep them in place. I always said, and I repeat it as many times as I can, we do not like to give people orders. We do that when we think it's really strictly necessary. So I think this order is still necessary. Speaking about what other counties did, you may be interested in hearing this. Sedgwick County is seeing a surge in the number of cases. Same thing in Johnson County. They were the first two counties where they lifted everything as an order and they just went to recommendations. Riley County is actually considering going back and reinstituting some of the restrictions that they had and then were lifting the last week or so. So short answer to your question, sir, is yes, I think those orders are still necessary.
Go ahead.
Johnson County is also, their county commission is meeting today to discuss going back to phase 2.
We probably expected more as we loosened up our, when we moved from phase 2 to phase 3, we expected probably more cases. That just goes to show that people are getting out a little bit more. Is it not, though, the critical number, how many people are hospitalized, that we don't overwhelm the system, and are we still basing it on how many people are in the hospital and how many deaths we have, or is it totally just, are we just trying to stop cases?
What we are trying to do is to mitigate the impact of this pandemic on our communities. So definitely the load on the hospitals is one of the major considerations. And we are doing very well. In Shawnee County, we are doing very well. But the other major consideration, and that's probably my highest concern right now, is the ability of the health department to keep up with those cases. Because the moment we stop doing the containment activities and mitigation activities we are doing now that are keeping our numbers still at the level that is more or less manageable, then we are going to start seeing two things. First of all, hospitals are going to be overwhelmed. And second, we are going to see so many people transmitted infection in some of the workplaces that are already at high risk, the business will have to close, as they had to do in Jackson County. The meat packing plant in Jackson County, they ended up with a positivity rate, I believe it was about 50% of their employees. They had shut down for weeks. They were not shut down by the health department. They had to make the decision. They simply did not have enough workers to show up. So, yes, we did expect cases to go up. I fully expected that. I said that in public. I'm not necessarily stressed out by the fact that our cases are going up. I don't want to see that increase reaching a level where essentially public health cannot cope with that. And then, the water floodgates open up and we are just boxed in our homes or in our workplaces and being infected by other people without any way to control that.
Commissioner Rippon?
Yes.
Doctor, what is our tipping point in a hypothetical world? Is it 10 hospitalizations? Is it 20 hospitalizations? Is it 40 hospitalizations? Do we have a set number that this is our green zone, yellow zone, red zone?
We have we don't have threshold like that, but sort of. We do know, and usually I present that information as part of my update. Unfortunately, this week we didn't have all the complete data from the hospitals, but we monitor how many beds are available, both in general and in ICU and ventilators. And in fact, one of the two hospitals has their own scorecard with green, yellow, and red along those metrics, and they report every day, not even every week, every day how they're doing. So the moment we start approaching the end of the yellow or the red in those scorecards, that's when we start having some conversation. That has never happened in Shawnee County. We have never reached that point. I really must say our hospitals have been incredibly busy and effective in making new space available for patients in case they needed it, and so the space is there. So I don't have a fixed number for you. All I can tell you, we monitor that, and once it reaches the point where the availability of beds, especially ICU and ventilators, starts being scarce, then we would probably be more concerned.
Our hospitals are regional hospitals,
Yes.
and so aren't we also providing hospital care for people that live in Osage, Jackson, Jefferson, Pottawatomie, Wabunsee counties?
Yes, we are. So the number of hospitalizations that I report here are not just all Shawnee County residents. They are just number of people in those hospitals related to COVID-19 disease.
All right.
Now, majority, vast majority are Shawnee County residents, but not all of them.
And also, as a regional, if we do hit an overload capacity, do we have the ability to have people go to other counties, such as Riley County, or if there was an opening in Johnson County for hospital care?
I believe that capacity is there. I think we are so far away from hitting the mark that I honestly, I can't give you the details. I know that there were discussions between our two hospitals and other partners in the state, for the matter, not even just in the region. And KDHE, the State Department of Health and Environment, was involved in some of those discussions to make contingency plans. So, yes, there is that possibility. That assumes, of course, that things in the other counties are better than Shawnee County. And right now, to be honest with you, they're not. They are actually worse than in Shawnee County.
But the fear was initially that we would be having people left on the sidewalk to die. And that, due to a lack of medical care, that we would be making those tough decisions on who to treat and who not to.
Right.
And we've not had that happen in Shawnee
No,
County.
no, we haven't had that happen. We can speculate as long as we want to speculate about why, and maybe one day, a few years down the road, we'll be able to have a firm answer. I'll tell you my opinion of the why. Number one, we acted very early in containing the virus as public health and COVID-19 team. Number two, we have two awesome hospitals who did so much good preparation and enhanced their capacity to a level where we never even got close to exceeding that capacity.
A month ago, we were at 55 active cases. Yesterday, we were at 102 active cases. So in a month's time, we had doubled our active cases. Are we able to extrapolate that and project forward that in another 30 days, we're going to be at 200 active cases? Or is
If the
that
if the current trend holds, yes, our current rate of increase is about, I believe it's 2.5% per day, and so that translates to a doubling time of a little bit less than a month, a little bit less than 30 days. However, if the current increase trend continues, I think that time is going to be reduced. So we will double our number of cases in less than 30 days. It just depends on how the trend goes.
So our ratio of transmission has changed, because the other day they came out, Dr. Lee Norman from the state, he had the transmission rate of 0.8.
For the state,
For the state?
yes,
Yeah.
yes.
And
Not
so-
in Shawnee County. I
so
mean, as
we're-
long as we're going up, we
we're
don't know
way
what
up.
the rate of
So
transmission
we're
is.
above that by quite a
We
ways.
are above, and there is a little bit of a complicated formula to calculate the rate, so I can't tell you for Shawnee County, but I can tell you, as long as we are going up in the number of cases, it means it's greater than one. And that's not true for the state as a whole.
And we're nearing having tested close to 10,000 people in this county. Is that about right? Or no, is that the state? Let's see. Yeah, that's state. And
I think
they're,
we tested even more than that, just in Shawnee County. We have about 1,000 tests a week.
so probably close to 10,000, I think is what I figured. I was using some numbers we have. And we've got a positive rate of about almost 5%.
Right.
Is that bad in the world of
It's,
viruses?
I would say
It sounds like a low number to me, but.
it is pretty low. It is pretty low. You want to have the number pretty low because it means that you are testing enough. If the number goes up quite a bit, it means either one or both of two things. Number one, you have a lot of infection there, so of course, you have a higher percentage of positive people. And or number two, you are not testing enough. Remember the chart I showed you where in April we had, was it 18%, I think, at the very beginning of our test? And that's because we were not testing enough. We knew that because we didn't have the test. So if you just test the most sick people, then of course your number is going up.
Sure.
But 5% is not a bad place to be.
The Shawnee County dashboard is 9,317
Okay.
monitor, or those are people tested.
Tested, right. That's what I thought. We do, right now, we do about 1,000 a day. At the beginning, we didn't do that many, so that sounds right,
Okay.
yes.
And then of those, 1.7 have died of the confirmed cases. That was using June 9th numbers.
It's a total of 8 people who died now.
And I'm not trying to diminish the death of anybody, but I'm just looking at numbers. That's 1.7 of confirmed cases. But then when you look at it for the whole population of the county, which is 176,875 people, that means that 0.0039% of the population have died from the coronavirus. That's very much less than 1%. That's 0.0039. That seems like a minuscule number. I mean, that doesn't sound like much. Is that, I don't know, is that a bad number? Is that,
I already said, we haven't had many deaths in Shawnee County, in part because of the age distribution of our cases is more towards the younger and more healthy people. I'm honestly a little puzzled. I'm not sure what point you're trying to make, Commissioner.
I'm just trying to put it in perspective of how bad the virus is in the county, just to give us an idea in numbers. I think a lot of people are very afraid of this virus. And when I read the numbers, this is not a death sentence for most people. A lot of people get it and they don't even know they have it. The younger people. I know in Dodge City, when they interviewed a lot of the people that tested positive, they were kind of surprised. They didn't know they had it. And if we are trying to work towards herd immunity, it's not all bad, I guess.
I respectfully disagree with your assessment, but
I'm not.
yes, you are entitled to your opinion.
I'm just looking at the numbers here.
Well, I'm looking also at other numbers. I'm looking at what happens in situations where public health didn't work as hard as we did in Shawnee County to contain that infection. So the numbers you're seeing are the result of everything we have done in the past 3 months.
Yep.
If you let the infection run wild, you would have very different numbers. And I showed you some projections a couple of weeks ago, how many hundreds of people would be expected to die in Shawnee County if we did that.
And Commissioner, isn't that where, and again, trying to anticipate where your questions are going, we are currently at phase 3.
Right.
We would be looking at moving to a phase 4 hypothetically by next week or week after. And so your question, I think what you're asking is, should we stay at phase 3 or should we just open up completely such as Sedgwick County and Johnson County have? And I think that based on the information provided by Dr. Pizzino, as well as the information we see in the news from Sedgwick County and Wyandotte County, Johnson County, is they are maybe thinking they had opened up a little bit too quickly. And so I think the question you're wanting to ask is, should we stay the course of where we're at, or can we open up our businesses, our community at this point safely, knowing that there is going to be a percentage that get, what is the risk factor? I think that's ultimately is, what is your risk factor that we would feel comfortable with?
Yeah, that is. What's our risk factor?
First of all, I think we should stay the course right now. I'm not recommending any kind of changes for the time being. I'm not sure if I'm going to recommend any changes next week. Assuming that we're going to meet next week, I don't know, but typically we meet the week when the current phase is set to expire, at least on paper. We'll see how the numbers will look next week. I remain a strong believer of the fact that our business will rebound only to the extent that people feel safe. And I think that people feel safer in Shawnee County right now because of the restrictions that we have in place than they would feel if we would say, there's no reason to worry, let's lift everything up Yes, our cases are going up by 30% every week, and they're doubling every 30 weeks, but, it's not a big deal. I really believe many more people would stay at home and not go out and patronize our business if we did that.
And so your recommendation then would be, again, staying our course that we're currently on right now, so that we do have consumer confidence and we can build the consumer confidence that it is safe.
Thank you, Commissioner. You said that in much better way than I did.
Right. I'm just trying to make sure that I'm understanding our discussion.
Not only you understand, you are expressing the concept even better. Thank you.
And can I just add?
Sure.
Based on the feedback that I've been getting, I think, with the exception of really a small number of people, I think people are pretty pleased with where we're at right now. The phase 3 people are allowed to do just about whatever they want. There are no businesses that are closed as a result of us right now. And I feel like we're at a pretty good balance right now between, people being, we are reopened. And then also the people who are concerned about safety. I feel, I've been getting positive feedback that, they feel like they can go out right now because of the protocols in place. And I think, with the exception of this farmer's market issue, I think by and large, folks are pretty comfortable right now with where we're at. And I think the purpose of this entire exercise that we've been going through since March has been to slow things down, to delay, with the intent that, we don't overwhelm the hospitals and everything, but eventually we have a vaccine. And I know that that's a ways off, but I'd like to hear if you get information that I don't. I haven't Googled it recently, but is there progress being made that you're aware of in the vaccination?
Oh, I'm sure the
development?
progress is being made. I'm not really tracking, I'll be honest, I'm not tracking that on a daily basis. But I know that people are working really hard. The most recent things I heard was that there was some hope that something could be developed by the end of the year. That is an incredibly quick and aggressive timeline, but we need to understand what being developed means. It means that probably by the end of the year, we may have something that can be tested in humans, but certainly not be made broadly available. I think for a real mass vaccination campaign, the most reputable sources that I hear from are still talking about, second half of next year, essentially.
But I guess kind of where I'm going is that if there were to be a vaccine developed, obviously it would probably be more accessible to those high-risk populations off the bat, so that once they're protected, then the rest of us who are not high risk could probably go about our business without much trouble.
That's certainly a plausible scenario, yeah. That
that's where
that
we
would
put it.
require a lot of policy decisions and coordination at the national level and then at the state and local level on how the vaccine is going to be distributed, the safety profile of the vaccine, and sometimes the people at higher risk are also the people at higher risk of complications especially from a new vaccine. So I'm not disputing your statement. I just want to put a little bit of caution there. Things are usually a little bit more complicated than a simple, black and white decision. But having said that, I would assume that if there isn't enough vaccine for everybody at the beginning, the people with the highest risk should, I think that at least ethically and from the public health point of view, they should be on the front line.
I'm not endorsing going to level 4.
Okay.
No. The only blowback I'm hearing from some business, and most businesses are up and running. The only blowback I'm hearing, some restaurants are they're working at half capacity, and a lot of them, their profit margin is just not allowing them to go. And then I was in a restaurant the other day, and I asked one of the waitresses, I said, you're just working half the time? She says, yes, we're only using 4 waitresses today, where normally they would have 8 or more. And so we still have a lot of people who aren't getting back to work because of that. I don't know if there's anything we can do to work with these restaurants to help them get a higher capacity, because, that profit margin isn't all that wide there.
Yeah.
But that's the main thing I'm hearing is
Yeah. And to be clear, we did not restrict the capacity of the restaurants.
No, I thought that for,
Well, the
Social
space that-
distancing.
Right, the social distancing, yes,
Right.
and that's a key element of the prevention, but we didn't tell them you need to work at 50% capacity. Now, we did that for bars, and there are other reasons for that, but as I reported before, my experience going out to restaurants, that they are not even working at the 50. So even though they are practicing the social distance, they have removed tables, they still have many tables
I
that are
noticed they're
empty,
starting to
so-
fill up more, though. I'm seeing. a
They are
lot
starting
more
to fill
people,
up.
and,
It's true, I
they're
was
getting
out
there.
after last night, I did notice that, yes.
So I mean, and I went to a very popular restaurant in Topeka not that long ago, and they had every other table shut down, every other booth. And it's a place where we probably would have had to wait prior to COVID. We just walked right in and grabbed a table without any trouble at all. I mean, even at half capacity, they're still not busy.
Yeah.
And that's, I don't think that the restrictions that we have in place right now are the hindrance. It's just public confidence.
So, the only thing I can say, back to the consumer confidence, as a health officer, I want to make a very clear statement. It is safe to go out if you keep your precautions and if you feel that you're safe enough. Nothing is going to be 100% safe. But we have measures in place. The restaurants are working really hard, and, I'm talking restaurant, but every business is working really hard to make their environment as safe as possible. I'm going out. I'm taking some of the risk. I think the risk is small enough that can really justify those decisions. Ultimately, it's everybody else, individual decisions, but I think we need to build the consumer confidence by showing that we are paying attention, we are keeping measures in place that are reasonable and yet can keep people safer.
Mr. Chairman, when we talk about that consumer confidence, let's tackle the thing that's probably the most, that I get the most asked about, the most emails about, masks. And I think that's what the majority of the folks here are about when we get to the discussion about the farmer's market. Some people think we should have no masks. Some people think we should have everyone have masks. Some people think maybe some masks when you feel uncomfortable. I've received criticisms and emails about, why aren't you wearing a mask? I see the three of you at the commission, and you're not wearing a mask. What example are you setting? I know that from our prior discussion, you had indicated that as long as we are socially distanced, it would be okay or acceptable for the commissioners to not have a mask on, sitting where I'm at, but I do have my mask with me, so that when I get done and I'm in public, I can put it on. And I know that this has been I'm giving you time to get to the slide, so I'm trying to delay as long as possible.
Keep going, Commissioner.
But there's been an
I'd like to start
ongoing
the
discussion
presentation.
about masks where they were not recommended,
Slideshow.
then they were recommended.
Ye-
Maybe they should be recommended. And we have an ever-shifting dialogue where I'm confused. What is it? What am I supposed to be doing? What's the right thing? Should I be calling out my neighbor because they're not wearing a mask, but I am?
You know,
You are entitled to being confused. A lot of
I
people
live
are.
my life confused.
Yes, well, but particularly on the issue of masks, you are even more entitled to be confused than other things. Here is one of the dilemmas that we are facing when we have a novel virus, a new virus that's circulated in the world. When we start, our knowledge is close to zero. We know what similar viruses do, but we don't know what that particular virus does. And so we try to guess and use some public health common sense, making recommendations, and then we move on, and we learn, and we learn, and we learn, and then we revise our recommendations accordingly. I think what you're seeing in the case of the mask is really the best case example I can think of how that is true, how the thinking has evolved. At the beginning, CDC did not recommend use of masks. Honestly, they will tell you that now in public, not so much because they didn't believe it was helpful, because they were afraid that there would be not enough masks for healthcare workers. And they wanted to keep the masks for that high-risk group. And there was really not enough evidence whether the cloth-made, the homemade cloth mask would be effective at all or not. That has evolved. So I did a little preparation for this meeting because I knew that this question probably would come up. I did a little bit of research. I shared an article with you. There was a good review on masks, and
As you're doing the presentation, again, the common themes are, if you put a mask on, you're more inclined to touch your face. And if you're going to be touching your face, you're really defeating the whole purpose of the mask. And so as we go through the presentation, just maybe even kind of focusing on.
and really, I really have only 2 slides, not another full presentation, but yes, I can try to address those things. So there are now at least 34 papers that support the conclusion that the overwhelming consensus that they help stem the transmission. Now, the key word there is they help. So they're not going to prevent it, but they are going to prevent it altogether 100% of the time. It's not a substitute for other measures. It's not a substitute for social distance. It's not a substitute for good hand hygiene, which includes do not touch your face. Yes, you have to touch your face and put your mask on, but if you do that, carefully, you really don't touch your face. You just put things behind your ears. I also look for papers that show no effect, the use of masks. And I found one that was published very early, around April, and then was retracted by the journal that published it because there were some problems with the statistical methods that were used to do the calculation. So really overwhelming conclusion there. And I found this fascinating. I didn't know about this until late last night. Don't ask me exactly how they did it, but the thing on the left shows the amount and size of particles that a speaker ejects from the speaker's mouth without a mask. And the one on the right is with the mask. And obviously, each particle, if somebody's infected, can contain virus. And I think that was a brilliant experiment. Again, I don't know exactly how they took the pictures, but it was pretty clear that masks do diminish the amount of saliva and other particles that are ejected from a speaker. So those are really the only 2 things I wanted
But
to.
Where you're at, you're not wearing a mask. And
I
as-
was, yeah, I'm wearing a mask while I'm
as you're
talking.
talking.
Right.
So with that slide, should I be putting my mask on at all times, or when I'm in close proximity?
You are 6 feet apart, give and take. I keep seeing the 2 of you are too close, but I'm sorry.
That's why I'm all the way over here.
Why do we use social distancing instead of physical distancing?
Got it.
Physical distancing is concrete, it's a measurable amount. Social distancing is when I quit talking to Kevin for 2 weeks. That's,
It happens.
there's,
Please do talk to each other because
All right.
we need you to
We
talk to
can't
each other.
do it.
the
But
term
no,
bothers me.
so
I don't know.
the mask is most helpful. So obviously, those particles don't travel forever, right? The 6 feet is really the kind of, we need a threshold, so we take 6 feet. But after 6 feet, the particles just die off or fall down on the ground. And so there is really no reason to wear a mask if you're not in a public setting. So I keep giving the example. I see, not so much now, but at the beginning, I used to see people walking their dog alone wearing a mask. You don't need to do that. You're not going to give the virus to your dog, and you're probably 6 feet away from your dog anyway. Even if the dog is in a leash. So, but it's a public setting. It's the mass gathering situation where the mask is really necessary. It's the contact within
So
6
with the
feet.
latest information, which again is an ever-evolving, changing field, the masks have some impact. How much impact we have yet not quantified, but the masks do have a measurable impact, and that you should wear them if you are in close proximity to another individual.
Yes, I think that's a fair conclusion. If you look at countries in Asia where the use of masks has been culturally accepted for decades, some of the countries where masks were used the most are also the countries that were able to contain the virus more quickly. So there is really, as I said, there is at least 34 papers published that overwhelmingly support the use of masks to diminish, not to prevent 100%, but to diminish the probability of infection.
I'm seeing, yeah, they say that masks are a benefit, but is that if they're worn correctly, or is that, I see everything from around the neck to just over the mouth to
Right.
hanging off one
Right.
ear.
So they don't work if they're under your chin, that's for sure.
That's true.
They just work if they can stop some of those particles on the left.
And I
So
see
they should cover the mouth and the nose,
And then I
essentially.
see a variety of masks. We have the Chiefs here, and then we have, I don't know, is that
It's more of a dust type mask.
more of a dusk mask?
I was wondering about your mask, Commissioner, but yeah.
But it has a more of a container, and it has more space so that I can
Yeah.
talk a little bit less muffled.
Yeah.
Okay.
And you know, if I'm not mistaken, I think the same experiment where I took these pictures from, they tested different types of masks, and to some variable degrees, each of them would decrease the number of particles that are ejected. So I guess any mask can do better than no mask at all.
Okay. Commissioner?
I got a couple questions. With the masks, I mean, we're talking about the particles that come out when I speak. So with that being said, when I speak, there's no particles coming out of my nose, and if there are, they're going downward. Is that a factor? I mean, is it just as safe? Because one of the things that we also keep hearing is that by wearing a mask, you're breathing in your own carbon dioxide over and over again. It's bad on your the oxygen in your blood, and so if people wear it over their mouth and not their nose, is that gonna still help?
A little bit is better than nothing, but really the correct way to wear a mask is to cover both your nose and your mouth. And the reason is that some particles actually will come out also from your nose, especially if you sneeze. And I doubt that the people who do not cover their nose then will put the mask up when they have the urge to sneeze.
I don't know. If somebody sneezes now, they're kind of shamed by the rest of the people
Well,
around them.
but, you know, I still remember my first class in physiology, so I'm talking, I don't even want to tell you how many decades ago, it was about sneezing. And I was totally surprised by how uncontrollable the reflex is. It's a very primordial reflex, so it happens. The other thing, since you're really so interested in masks, at the beginning we thought that the main purpose of the mask was really to protect others. So, you know, the slogan was, I wear the mask for you, you wear the mask for me.
Right.
There is now growing evidence the mask actually even protects, to some extent, the person who is wearing the mask, which is another reason to cover your nose, because you can inhale particles that someone else has ejected, and if you're protecting your nose by virtue of a mask, you can decrease your probability of being infected. So that's, speaking of new developments, again, unfortunately, we need to get used to the idea that this knowledge will evolve, and so what we said yesterday maybe it's going to be refined next week. But we're learning more and more about masks, and it's going all in the same
There's-
direction.
Every hour you can pick up and get a new comment from somebody about masks.
Well,
It-
and can I just follow
Sure,
up real
sure.
quick on, you had on your slide 34 papers. Could you elaborate on that? I mean, everybody's got an opinion these days, and so are these YouTube videos by Bill Nye the Science Guy? Are they, could you just kind of elaborate on those 34 papers?
Yes. So thank you for using the word opinion, because I really think there is a big difference. Everybody's entitled to their opinion. People can not believe that masks help. Fine, I respect that opinion. What I'm trying to do here is going beyond opinions. I'm trying to show evidence. And so when I say 34 papers, most of them have been peer-reviewed for publication in journals. Some of them have been released early while pending the peer review, but they were strong enough that the authors thought that they could make them public. These are research papers. These are not just, people making up this stuff. So what I want, my message is, you're entitled to your opinions, you're not entitled to your facts. This is the best evidence that we have today, based on scientific research on the use of masks. Now, people can still disbelieve it and say, I still don't believe it. I don't believe the seat belts will save life. I don't believe that, a lot of other things that we do what they do. That's fine. But let's distinguish between opinions and facts, and let's use reputable sources. I do not want the message, when I say our knowledge is evolving, I don't want the message to be you can't believe anything. Not all sources of evidence, quote unquote, are equal. Not all sources of information are equal. And these are all reputable because they're done by researchers, and they are screened then by peer reviewers who assess their methods for appropriateness.
I have a question about the governor's plan. Dr. Lee Norman, in the plan, in Phase 2, recommended masks. In Phase 3, I can't even find that he mentioned it. Do you know why he doesn't have any recommendations for masks, or is there any reason for that, or?
Was it not there on phase 3? I thought it was on phase 3.
I couldn't find it in phase 3. I couldn't even find the term.
I
It just
thought
said,
it was part of the
it said
personal
personal
protection
hygiene.
that
That's what it
applies
said.
to
It said
all
personal
phases, but-
hygiene. Oh, I have it here if I dig deep enough.
First off, I can't tell you for sure because I haven't talked to Norman, but I know that every phase we went forward, they would go back and evaluate each phase and write different pieces in. As you saw, 1.5 came up, and then 2 and 2 with adjustments and all these other things before we got it back to us. So they were doing just like us. Every time we'd get to a certain point, we'd have to evaluate it and then go forward. So there's a lot of stuff in that final couple of phases that weren't fleshed out because they weren't at that point. They were pretty inundated with everything around the state. So that would be my guess, is that they just didn't get there to round it out. But again, that's just a guess.
All right.
It's an interesting question. I will ask Dr. Norman and
I
report to you
don't
next
know.
week if you want. But I can tell you that at this point, all major professional and public health organizations in the world do recommend the use of masks, starting from CDC to the World Health Organization and everybody in between.
Can we shift gears to talking about the farmer's market for a minute? And thank you, Dr. Benzino. But hang around. We have some questions.
First off, the discussion we got into on Monday brought up a lot of stuff that we talked about in the assessment team. So I want to thank everybody who come up and had public comment, especially those vendors that were out there and talking about the heat. That got us thinking about the multiple threats, not just the COVID, but the heat threat and beyond the concrete and all those other kinds of things. So we did go back and did some more research on being outdoors, the heat-related illnesses, just all those things combined. We also talked to other outdoor vendors, for instance, the nurses that are running the testing line and those volunteers wearing their stuff 8 hours a day, and they were like, yeah, stupid, it's hot out here. So yeah, I get it. I understand. So we started looking at it a little bit deeper, and so kind of building on what Dr. Benzino was talking about, the mask, that 6 foot distance is really key. So we've taken out the restriction for masks. We also added in here, I'll go over this whole thing in a minute, but we also added in an option if people do want to wear a mask, but it's so hot that they can't bear it, but they do want to have that protection. We put a link in here to a mask, actually a face shield, that attaches on, that allows the air to go through, but it does have a barrier. And that's really the key, is having a barrier between you and the customer. So we're looking at, the other thing it brought up was not just the farmer's market. We looked at all the events coming up in the summer where it's still going to get hot. We do have First Friday where they set up tables outside. We have baseball games where they set up concessions, selling the baseball cards, photographs, all those kinds of things that are going to happen at craft shows, art shows, car shows. People set up tables and sell things. So we looked at the opportunity, I guess, to open that up, and this made sense to us. I also want to thank Steve Lenderman. We went back and forth. He helped us do some research on farmers markets and some other outdoor venues. So this was written together, and I really appreciate your help. You took some of that work off of us and coordinated with us, and it was a pleasure. So I know that's out of protocol, but thanks. So going forward, we looked at outdoor vendor. Let me put my glasses on. Outdoor venues include farmers markets, sports venues, outdoor displays such as art shows and other similar venues. Can't capture everything. We're just trying to get that intent. So these are outdoors. Vendors should wear masks, as we just talked about, that distance. Should wear masks when unable to maintain minimum social distancing of 6 foot or directly interacting with customers. And Dr. Benzino just went over the 6 foot and why. Not a requirement. They should. When social distancing is in place, there is no direct customer interactions. Masks are encouraged for vendors, staff, and customers. In other words, outdoor, working at out on a farm, for example, there's no reason for you to wear a mask if there's nobody around you. That doesn't make any sense. So lifeguards, those kinds of things, setting up on the lifeguard chair, getting weird tan lines because of masks. We don't want that either. So those are the kind of things we're looking at. If there's nobody around you, there's no reason to wear it. If you're in, again, you should wear it if you're in direct contact with a customer. It would apply to any vendor that is not contained in any temporary hard shelter, 3 or 4-sided tent, or permanent structure that allows the air to pass through. If you have an awning, that's 4-sided open, a lot of wind passes through. If you're in a tent, that's not the same kind of thing. If you're protected on 4 sides, it doesn't allow that air. So this, that would be more of a retail venue type solid structure. So this is strictly talking about outdoors.
Would this apply to fireworks stands as well?
It would. Moving forward.
Second.
Hey, Dusty, so.
Sure.
Let's just go through. Sunrise Optimist Club, when they're working at the baseball diamonds, selling the concession stand, it would apply to those sorts of organizations that are outside.
If it's an open air, just a table, or has an awning, this applies. It's not a restriction.
Our car shows,
Not a restriction.
so.
This applies to anything that's outdoors where the air circulates all the way around you.
Okay, so even to, if we get to a fair or a horse show that's outside, this is going to be applied across the board.
That's correct.
Okay.
And again, that's the other similar venues is what we're trying to capture. It's hard to list every single thing.
If
So
you have a protest in the street, do
we don't regulate protests. Again, we go back to recommending mask wear. These are for retailers specifically.
Because
So
I know to a lot of the public out there, I've had some emails, I don't know if the rest of you have. I said, how come protesters can be out in the street and no mask, and we're at the farmer's market and they want Matt? People don't,
again, we're
they don't
addressing-
separate the part,
right.
the two.
We're
It's just
addressing
a
retailers.
perception.
Yeah, I totally agree. Believe me, I get the same comments, but we're talking about retailers and the stuff that the health department and the health officer is engaged with. So this is talking about retailers. If they're talking about protests or anybody at a open air car show or anything like that, that's not an organization that we're talking about. These are specific to retail or those kinds of things. So down at the bottom again, the open air environment, sunlight, breeze, and ability to move, and keep 6 foot distance possibly. Again, this thing is changing, so we just want to put that caveat in there. Provides a lower risk of community spread in an indoor venue. So, than an indoor venue. So being outside, we believe is actually going to help keep that spread down. And again, this next part is just people who do want to wear masks or think they want to have that protection. We did find this option of a face shield. This is just an example. They may use a face shield instead. That's going to offer the same protection. Again, it's that barrier. And we just put a link in there so you can get an idea of what we're talking about. And then, as always, and the farmers market vendors brought this up the other day specifically. I know Commissioner Mays, I'm talking to all you guys too, but you and I had a specific talk. We do personal risk assessment. If we go up to someplace and we don't feel comfortable, we don't have to go. You don't have to buy from a certain vendor. You don't have to go to a certain restaurant. If you feel unsafe, go somewhere else. And, so that's, you got to make the choice. And again, it goes back to choice on this, to keep yourself and keep yourself safe. So this is a Phase 3 guidance amendment. The plan is, Phase 3 plan is already there. We did not separate in that original document outdoor vendors. This does separate outdoor from indoor and takes the restriction off the mask wear as in the previous retail that we discussed last week.
Yes.
Dusty, I have a question about, we received an email earlier today, I don't know if you guys had a chance to get it, it was right before the meeting today, about a restaurant who has closed their dining area but is doing all of their business out in the parking lot now. Would that qualify under an outdoor, so they've got people running food out to cars and things?
If they can keep the 6 foot distance. My guess is if they're handing it off, that's probably not 6 foot. So that's one of those, you're kind of in between. So, but that would almost qualify for this, I would say, but
But they could probably make a couple adjustments and.
if they made the adjustments and then keep the 6 foot distance, just like we talked about on this.
And in events they can't, they, as long as they had a face mask or is a face
Face
shield
shield,
as opposed to a mask.
Yeah,
There was a pizza place in town that would bring your pizza out, put it on the hood of your car.
exactly. That's exactly
Works
what
for
we're talking
me,
about.
I guess.
Yeah. You can get,
So,
Well, I appreciate everybody working together to come up with this. I mean, I think based on the conversation that was had on Monday, or was it Monday?
It was Monday.
Thursday. Every day seems the same now. But I think that conversation, it became pretty obvious that outdoor venues should be treated differently than an indoor venue. And this recognizes the fact that the farmer's market is a unique situation that's not the same as a grocery store. Even though they sell similar products, it's a different situation, and I think this addresses that. And I think this should be sufficient for them to operate in the capacity that they need to.
I agree. That conversation, like I said, spurred on a whole lot of, a lot deeper than just the farmer's market, but the concept of being outside, absolutely, and doing vendors outside had to be addressed differently. And that's what we came away with on Monday, is thinking, wait a second, there's some valid points here. We need to really look at this, and that's where this came from.
So,
One of the things I'm seeing just all over town, I'm getting out quite a bit now, and I'm seeing a disregard for a lot of our orders. I mean, it's like an Irish democracy, where we give them orders, and as soon as we turn around, they do whatever they want. There's no way of really policing it all, is there? There really isn't.
It's, if we get a complaint through the COVID, and I will say documented complaint, and I'm just going to be transparent here. Sometimes it's a competitor griping about another competitor, and it doesn't necessarily turn out to be valid. Other times it's valid, but until it's documented through the COVID info, and we have that process start, we call them and just discuss that complaint. The next time it comes up, then we call them. The first call is, do you understand? Do you have the documentation? Do you have the phase guidance? I got to tell you, probably about 60% of the time, they don't even have it, so they didn't even know what it was. They're just going off word of mouth or some Facebook site. So we get them the data. The second call, can we help you? The third call, what's wrong?
Okay.
The fourth call gets an on-site visit, and then we go from there. We haven't had to go past. I've done 2 on-site visits. I know 2 other members have done 2 on-site visits, and it's fixed. It's just minor stuff. And I got to tell you, sometimes we go on-site, and the complaint isn't valid at all. So.
But I think, Commissioner, your point is valid. We can't be everywhere all the time.
No.
And so
Yeah.
it's no different than crime. I mean, we can't stop all crime. There's not enough law enforcement officers that we would ever be able to hire to stop all crime.
and even if there were,
And
Still wouldn't catch it.
and in the same manner, we do the best that you can with the resources that you have allocated.
That's correct, sir. And I know some other communities around the state have, I won't say done enforcement necessarily, but they have promoted those safe businesses. So people know where the safe businesses are, and maybe that's something we can look at as well.
I think it's important to note, and if we could just get this out to the media and to the public, Shawnee County has no interest in shutting down business.
Absolutely not. I
We
work very
want-
hard to keep them open.
We want economy, we want people out working, we want people shopping, we want people living in their community and enjoying their community. And so Shawnee County, we have no interest in shutting down your business. But we also have a public health and safety, and we need to take some precautions.
So, but if I could, this is just a personal relayance of information. Again, I don't fear the threat. I do respect it. I wear masks and I keep my distance. I did have a reason to go to the emergency room yesterday, take a family member that was outstanding. If you have to go to the hospital, go to the hospital. I do risk assessment. It is very low. Go if you have to go. Don't fear that. So please don't wait to get any kind of health care if you need it. The other thing is, I've been going out to restaurants. They're doing pretty dang good. So I'm
Mr.
comfortable
Mace?
doing something.
I think I'm pretty happy with this. I'd make a motion that we adopt this amendment.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
We have some people here that have been waiting a long time to speak, and so if you'd like to get up and talk about farmer's market or whatever you're.
Commissioners, Steve Lanterman, I represent the farmer's market. And first off, let me just say, when I was here last time, I spoke, and indicated that there were just some communication difficulties between the health office and the farmer's market. I will say that in the last few days, I've had an opportunity to communicate with Mr. Nichols. Mr. Crowell was also on those communications. I personally could not be more impressed with the responsiveness. I thought that was phenomenally done, and I deal with a lot of governments, and I truly commend Mr. Nichols for his professionalism in dealing with me on all aspects of that. We looked at this plan and worked together to kind of come up with some of the language on it. And so, at least in terms of this plan, and the Phase 3 guidance, I think that helps. Now, my client would also note that there are a number of farmers markets out there that right now are not requiring masks. And they're all over the state, and in areas not just Wichita and Johnson County, but also in areas throughout where, there are some hot spots, and they're not requiring the mask for the farmers market. And I do think it is a different environment, which Mr. Nichols fully recognized, in that they are in the middle of the day on hot asphalt without any shade. It's basically a parking lot. So, I think that, from my client's perspective, we'd like you to still look at this, consider this aspect of, what a farmer's market is, how it operates, and look at that when we're addressing, the further guidance on this, and making sure that we, keep that in mind as we go forward. This may be an entity, especially as we get into the heat of summer, where, we look at that, open air, et cetera, and there is some justification for an exception that gets us away from the masks for them, in particular, just owing to the nature of how that business is conducted.
Commissioner Cook.
Mr. Lanterman, I don't want to ask you to get out your Black's Law Dictionary, but when it says vendors should wear masks, I interpret that to be completely different than must or shall.
You are correct, and I want to, that is part of the thing I commend Mr. Nichols on. My concern with language such as should, and making it so that the general public reads that correctly, and we don't end up with a battle whereby you have people going, that said should, and you're not doing it. And that's a battle we always fight. So when you use the word should, I agree with you. I think that makes it a recommendation as opposed to the firm language. But when you're dealing with members of the public and you're dealing with that kind of language, just as we saw earlier today with the word may and any, we start dealing with that language and people take a different interpretation of it. And that is a concern that we have, is that we're going to end up with the same calls. But I do think that this is, I agree this is a necessary step, and I, again, commend the county for taking it.
And I'd just like to go on record then as saying that and correct me if I'm wrong, but the intent of this commission today, at least from my vote, is that it is highly recommended.
Okay.
It's an expectation.
But, and Mr. Lanterman, we do have farmers markets across the state that are much more restrictive.
We have some that are more restrictive. When I looked at it, I actually found that the number that were basically operating freely without masks were more than the ones that had the mask requirements. When you're looking strictly at numbers, I'll be honest with you though, I looked at a sampling, I think of about 8 of them, and I didn't get any further. And the bigger problem you've got when you start looking at those is you're really just pulling from the bigger cities because they're the only ones that really have a website that advertises their rules up front.
And then even the City of Topeka Library, the Shawnee County Library has a farmer's market that requires, and so there are some that are more restrictive, there are some that less. This is a compromise between the two.
Yes,
It's highly recommended, but it's not required.
yes. And again, like I said, I thank the county for working with us and for coming up with this and for helping us out in this regard.
Thank you for your work. How many here are with the farmer's market and how many of you are okay with the agreement that we've worked out? One person, 2, 3, 4? Most of you, okay. All right. Is there anyone else that would wish to speak at this time?
Just a quick comment, and not even about the farmer's market. But I wanted to come today, my name is Jen Van Dalsen, just to reiterate something that Dr. Pizzino has said a few times now. I think that there is a number of people in our community that are either seniors or fit into that high-risk community or a high-risk population. And sometimes I feel like within our community, there is a thought of, if you're not comfortable, you should just stay home. Just stay home. And oftentimes that's said with harshness, like, we're just going to move on without you. As a family that continues to follow physician advice and take great care, I can tell you that's a very challenging place to be. It's not fun or easy, but it is necessary. But I do really appreciate when our community includes us as part of the economic recovery plan. We participate in Topeka. We like being here. We want to be here. But we need to be included in that plan. There are some basic facets in that inclusion. You hope everyone washes their hands, but you don't know. You hope people social distance, but that really requires that everybody that's standing there understands what that is and chooses to participate. And I know from experience that that's something I want, but doesn't always happen because the other person is not going to participate. The only thing that you can visibly see is the mask. And the mask is important to us because, again, we're just trying to follow orders that we've been given from our doctor. We've done from a very long time. We're used to doing. We're glad to do. We trust them. And I trust Dr. Pizzino. And so I just want to reiterate, I was just reading a survey just a couple days ago that said of registered voters in the United States, so I don't know what Topeka would be, but 50% are still not comfortable going out to restaurants. And that is just because people still need to feel comfortable. And sometimes it is a need to feel comfortable, but sometimes it is actually because they're following physician advice. So please just remember us, remember that group of people in your plans. And if you do that, I think you'll take care of the entire community as well. So, thank you.
Thank you.
Thank you.
Mr. Chairman?
Yes.
If we might, Mr. Lanterman, we still need the plan from the farmer's market.
Well, and I apologize to the extent that we have not gotten that yet.
Okay.
We've been kind of working through language on everything, and I had a meeting with the board late last night. I don't think it'll be a problem getting the
Okay.
plan, but we'll get that as soon as we can.
All right, I just want to make sure that we don't have any hiccups, and so we can make sure the farmer's market's up and going tomorrow. 'Cause I know that there's a lot of people expecting it to be open.
Yes, and we will have a plan over. I don't anticipate any issue with getting that. It's just a matter of me getting the time to work to get something together.
I appreciate that as well.
All right.
Mr. Chairman.
Yes.
I'm going to change the subject just briefly and go back to something that was said earlier. in Dr. Pizzino's presentation, he mentioned the folks that are working at Highland Park High School. They've been out there in the heat in spacesuits, and a lot of those folks are not even employees, they're volunteers, and so I just wanted to publicly thank those folks for doing what they're doing out there. I know it's a tough job, and they're doing it because of their care for the community, so thank you.
Absolutely.
Okay. We have anyone else who would like to speak?
Just very briefly, Jim Kraus, Shawnee County Councilor. I want to thank Mr. Landerman for his comments and just make it clear that throughout these last few months, we have very purposefully used the word shall to mean mandatory. And if it does not say shall, if it says should, that's a recommendation. So we're not trying to play games with the word should. I just want to reiterate what has already been said. Shall is mandatory, should is a recommendation. Thank you.
I've noticed other towns have, or Johnson County uses expectation now. They had to be different. So, anyway, any other comments or anyone else wanting to speak? Yes.
Lucky for you, almost everything I had to say has been addressed, thankfully, and so I appreciate that. Since we're talking about masks, my name is Patty Rogan-Moser. I'm a resident of Topeka. Yesterday, I went to every county's website and dug around in the state of Kansas to see what their current update is regarding COVID-19. Out of 105 counties, 90 have no mention of masks, and as of yesterday, 43 counties have no restrictions at all regarding COVID-19. They are completely open.
How many? What was that last?
43.
43.
Another 12 counties use language like strongly encourage, recommend, basic health guideline, should, with regards to mask wear. Only 3 counties out of 105 have any mask requirements at all. Leavenworth County says you should wear masks in public. They're only required when visiting the courthouse, interestingly enough. Republic County, masks shall be worn during personal services like tattoo parlors and hair salons. And then they provide links for restaurants and other services like that. And then there's Shawnee County, which is very restrictive. Almost everything is shall. Since we're having the conversation about, wording, I still would recommend that, given that we're in phase 3, in 10 days we are likely to move into phase 4, that perhaps it might be a time to change the wording from shall wear masks to strongly encourage to wear masks or should wear masks in these public settings where right now the wording is shall. And then give, Shawnee County residents the benefit of the doubt, the option to choose how they would like to proceed with their own health risk going forward. So, thank you.
Oh, well, thank you. I tend to agree with you. I mean, it's really kind of unenforceable, and most counties aren't doing it right now. Everybody does their own risk assessment when they leave their home. And I'm kind of a freedom of choice sort of guy, I guess. And I feel like if you don't like a place that's not wearing masks or you don't like the way it looks, go to the other place. So I would certainly be in favor of loosening our wordage in this where we go to a recommendation rather than an order of all these orders. So, yes.
Mr. Chairman, we've had this discussion time and time again.
I don't know.
I feel like right now, there's no mask requirements for people except for cashiers and servers, basically. I don't think that's an unreasonable expectation at this time. And so, we aren't even, they're recommended in the courthouse. We're not requiring them. There are people here today that are not wearing masks. There are many that are.
Except for the courts.
except for the courts, but that's not our doing.
That's the Supreme Court.
That was not an option for us. That was something that they implemented on their own. I feel, like I said earlier, I feel pretty comfortable with where we're at right now. And I think we should stick with it for the time being, and just take no action.
And I concur. I think that I'd like to see our numbers get stabilized a little bit more. And candidly, I know that when we look at the number of younger people that are impacted and affected, that's the highest category, and maybe they're not affected as much, but still, I do have some concerns seeing us go from 50 30 days ago to 100 today. At what point I think we need to make sure that we don't explode, and I would hate to see us ever go back. And I think if you look at some of the counties that did, Sedgwick and Johnson, Riley, I don't want to be in that category of trying to go back. I'd like us to continue to move forward.
Well, make no motion then.
All right.
I think that's going to conclude our meeting today, so we're adjourned. Thank you.
Thank you all.
Thank you all for attending.